Alright, so today I'll be performing the muscle test. I'm going to test the gluteus medius right now. My stabilizing hand on this side, I'm going to internally rotate this, drop it an inch, and now I'm going to have you push out real quick. Alright, that's gluteus medius, and then we're going to do psoas major test. I'm going to lift your leg up 45 degrees up, keep your leg straight. 45 degrees lateral. And then I'm going to grab our ASIS, externally rotate your feet, and then you're going to have to push in and out, or up and in. There you go. Psoas major, and now I'm going to test your quads. I'm going to have you bend your knees. And then can you lift up as I resist? Alright, you're good. That's the muscle test. Adjusting the navicular bone now. With my lateral hand, I'm going to stabilize the lateral malleolus. And then with my middle hand, I'm going to go to the medial arch of the foot, to the navicular bone with my thenar eminence. I'm going to pivot my feet 45 degrees. I'm going to grab it with tension. And then I'm going to give it a little impulse. I'll be adjusting the cuboid bone now. My medial hand, I'm going to wrap around the lateral aspect of the malleolus, just superior and laterally to the cuboid bone. And with my other hand, I'm going to wrap around to reinforce it. You got to bend down now, put your feet behind my knees, squeeze the knees, grab it in pre-tension, and then you're going to adjust inferior to medial. You're kicking your legs back. So I'll be adjusting the cuneiforms now. With my headward hand, I'm going to slide down her leg, just below the malleolus, and then wrap my index finger around the medial arch, palpating the navicular. And then with my footward hand, I'm going to wrap around, my pinky touching the index finger, and then with my headward hand I'm going to provide traction, and then with my footward hand I'm going to provide dorsiflexion, and then my impulse is going to be I to S. That's it. Alright, so I'll be adjusting the met heads now. You got to elevate the patient's leg, and then contact with your thumb on the met heads 2, 3, and 4. And 2, 3, and 4 are going to go I to S. And met heads 1 and 5 is going to go S to I. And that's it. So now I'm adjusting talus. With my inside hand, I'm going to slide down the tibia just below the malleolus with my pinky on the talus, and then lift the patient's leg. I'm going to wrap around my other hand. I'm going to bring tension, and then dorsiflex, evert, and then I'm going to Nike scoop it, going posterior to medial. So I'll be adjusting the calcaneus now. With my lateral hand, I'm going to stabilize the calcaneus. With my medial hand, I'm going to just go in the medial arch with my thumb on top. Stabilizing the calcaneus, I'm going to move the medial arch counterclockwise and clockwise. Alright, so I will be adjusting the fibula head now. You got to bend the patient's leg slightly, find the fibula head, palpate it, wrap around, going S to I, hiding your knuckles with your lateral hand, and then you're going to lift the leg up an inch until you get that full tension, and then with your inferior hand you're going to go posterior, anterior,